Thanks to advances in healthcare, people are living longer lives. That means our patients are living with complicated diagnoses which require diverse outpatient care. Unlike inpatient care, which may be a small part of a patient's life, outpatient care follows a patient for a lifetime. As ambulatory nurses, we are there for our patients throughout their lives to provide preventative care and promote the best outcomes when acute and chronic health care is needed.
The value of an ambulatory nurse for Penn State Health is immeasurable. It's a very crucial function. It allows physicians and advanced practice providers like PAs and NPs to work at the top of their scope of practice, and having dependable nurses to handle patient issues as everybody's doing their thing is a very, very vital part of the organization.
I think working as an ambulatory nurse actually does provide a great breadth of experience and a lot of opportunities. For example, in ambulatory nursing, they're getting a tremendous amount of triage experience. They're encountering all different types of patient concerns and having to learn skills to triage those concerns the patients have. They get to assist providers with procedures. So if they're a nurse that likes to be hands-on or get involved with surgical procedures, they have that opportunity.
In primary care, nurses have a variety of job functions. They help patients understand what medications they are taking and why. And they act as a guide for patients in making informed health choices while teaching patients about their condition and how to manage it.
People think if you're a nurse, or an RN even, you have to work in a hospital setting. That's not true at all. Here at the clinic, we room patients. We have the lab, so we get to do lab draws. I actually really enjoy the lab. I like drawing blood. It doesn't take much to make someone smile or be happy, so that's what we strive to look forward to, for patients coming in. We want them to have a good experience and a good time with us nurses and providers.
I did hospital nursing, I worked in NICU for many years, and I just always was attracted to the heart and cardiac nursing. So when this opened up for me, I jumped at the chance.
Ambulatory nursing isn't just primary care. There are a number of challenges and diverse specialties which require specific skills to deliver vital care to our patients. A nurse could serve as a care manager to coordinate services, a diabetes educator to help manage their chronic condition, or a specialty nurse using their high-level skill set to help patients in such areas as infusion, surgical specialties, or cardiac care.
My title is actually Clinical Case Manager, and I do a lot of cardiology triage phone calls. I'm also involved in the cardiac stress testing. What we're doing is we're looking for basically blockages in the arteries to the heart. Somebody with chest pain, we want to see if it's actually heart pain.
The day, it varies depending on where you are in our unit. So we have pre-procedure, post-procedure, and in the procedure room. Pre-procedure, we get patients ready. In the procedure, we can either be the technician helping the doctor with the procedure, or circulating nurse, recording things, keeping track of everything that's going on, or you could be in recovering the patient afterwards to discharge them and get them home.
For those seeking more, there are opportunities available to pursue leadership to help update and expand clinical, organizational, and professional roles. Ambulatory care registered nurses can also provide leadership in the clinical and managerial operations of the organization.
I see nurses really as being a great connecting point in ambulatory care. Whether that is, direct clinical leadership at the bedside as a senior attending nurse, whether it's practicing as a nurse manager in a clinic, whether it's doing, project management work. We really act as translators and navigators across the system. And I get to work with people from a broad variety of backgrounds. Together, we're able to sort of tell the whole story of healthcare as a team.
Whether you want to work in primary care, specialty care, or leadership, now, more than ever, nurses play a critical role in patient care in the ambulatory setting.
I think one of the things that makes this clinic unique from all the others is that you have a highly skilled, trained, seasoned nursing staff that is passionate about these kids that we take care of, because we want to make the difference in the life of a child and in the life of a family.
To join us, please visit our website,